Hi, it's Dr. Delaney, and I'd like to spend the next few moments to talk to you about lower eyelid exercises that we sometimes prescribe to our patients. So if you had a lower blepharoplasty with me and we ask that you do exercises, these are the two exercises we're going to have you do. Now, if you've had a lower blepharoplasty with me and I didn't ask you to do these exercises, maybe you don't need them. So check with me before trying them, okay? And of course, if you had surgery with someone else, please make sure you check with your surgeon first before attempting the surgery. So the rationale behind these surgeries is the lower eyelid itself is a delicate and floppy structure. So when it's healing, swelling may pull it away from the globe itself, or it may want to pull down. That's very common and typically heals fine on its own. However, with the following exercises, you can speed up the recovery and make it a lot faster. So the first thing we want you to do is to stretch the lower eyelid. So you want to grab the lower eyelid near the edge here, not on the pupil because you want to poke yourself, near the edge here, and just gently pull up until your eyelid margin is higher than your pupil, and you want to hold that for about 20 seconds. And that's it. You don't want to grab the cheek here. That's not going to do much. You want to grab the edge of the eyelid and go like that. If you had laser resurfacing and your eyelid's greasy from ointment, make sure you have a little gauze or a little Kleenex so you have a little bit more traction. So that's the first exercise. The second one is squinting. The lower eyelid muscle is temporarily weakened after surgery and has some loss of function, loss of tone. So basically the squinting is a form of rehab to get it stronger. So you want to kind of picture yourself trying to close your eye by bringing your lower eyelid up. You want to squint hard, 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 and hold for about 5 seconds. All right, so that works your entire muscle called the orbicularis oculi, especially the part in the lower eyelid, to get that stronger. So you want to alternate between those two exercises, the lower eyelid stretch and the squinting, and do it as often as you can throughout the day. You want to try to shoot for maybe 20, even 30 times. Just whenever the thought crosses your mind, do a set, go on about your day, and then if you remember, do another set again. Now, what I don't want you to do is to do 100 of these back to back. That's probably a little bit too much and can irritate your eyes. So you do want a little bit of downtime in between sets so your eye can recover. Of course, if you have any questions, make sure you call and ask the office and clarify with me first before attempting anything. And again, if you had surgery with another surgeon, please check with them before attempting these exercises. Thank you.